Hi, everyone. My name is Priya Ranganathan, and I work as Professor of Anesthesiology at the Tata Memorial Center. I'm very happy to be part of the WomenLift Health 2024 India Leadership Journey. And my research project is gender representation in leadership roles in oncology in India. So we know that globally, women in medicine are underrepresented in leadership roles. And this is particularly true of oncology, which has conventionally been a male dominated domain. From India, there is very little data about women in leadership roles in oncology. We know that women face several barriers to career progression, including the lack of mentorship, gender bias, unequal opportunities, and challenges in maintaining a work life balance. And so the questions that I am trying to address are: what is the representation of women in leadership roles in oncology in India? And what are the barriers and facilitators influencing gender equity in oncology leadership roles? This is a mixed method study. I'm going to start with a survey, which will involve a structured questionnaire sent out to heads of cancer institutions to ask them about leadership roles held by men and women in their institutions. And this survey data will be supplemented with publicly available information from institutional websites. I'm going to follow up the survey with semi-structured interviews with a subset of respondents, including women in leadership roles and departmental heads, to understand their perceptions, their views on barriers for women in healthcare. My analysis is going to synthesize qualitative and quantitative findings to develop a comprehensive understanding of gender representation. I plan to share my findings with the leadership of the participating institutions. I will also publish my results in peer-reviewed journals and present some of the insights at national and international conferences. Why is all of this important? We know that gender equity in leadership roles is a strategic imperative for improving healthcare outcomes. It brings in varied perspectives, it fosters inclusive decision making, and it enhances organizational performance. Through this study, I hope to identify some actionable insights to inform policy and practice. For example, tailored institutional strategies or mentorship programs targeted at women leaders in oncology. I hope to get comprehensive data on gender representation and leadership trends in Indian oncology and some insights into systemic barriers and facilitators for women in leadership positions. I also hope to come up with some recommendations for promoting gender equity in oncology workforce policies, and overall contribute to the broader discourse on gender diversity and leadership in medicine. I've tried to incorporate various aspects of the leadership journey and the various pillars of leadership in this project. Authentic leadership. So I want to lead with a purpose, and this is a purpose very close to my heart, which is to help other women to achieve their goals. Inclusive leadership. So I'm trying to use this study to reveal some of the biases that women face in their leadership journey and to use my experience to help others. Strategic leadership. I want to lead change and inspire action and use my power to influence change. Impactful leadership, because I think this study can be expanded across cancer centers in India. And I have used my learnings from this journey by incorporating others' experiences to shape the survey and interview content. Thank you very much.